Do I really have PCOS? Is this really PCOS? This is one of the most common questions I hear. Sometimes people are convinced they have it, but haven't been diagnosed. Or other times they've been told they have PCOS, but it just doesn't feel right, or it just really doesn't look like the PCOS their friend has. And that's the tricky part. The diagnosis isn't as straightforward as it sounds. And if you don't get this right, every decision after could be off track. And no two people with PCOS can have the exact same symptoms. It can look really different in two different people. I'm Dr. Mélanie DesChâtelets. I'm a naturopathic doctor licensed in British Columbia, Canada. And I'm the founder of PCOS Health Collective, a clinic, and also the founder of a worldwide community called PCOS Shift Society. So today I'm going to walk you through exactly how PCOS is diagnosed if you're 20 or older. By the end, you'll understand the 2 out of 3 rule, what counts as irregular cycles, why not everyone needs an ultrasound, and even a 2023 blood test that's changing the game. So, the 2 out of 3 rule. This is called the Rotterdam Criteria. And for adults with for PCOS is diagnosed when 2 out of the 3 Rotterdam criteria are met, after also ruling out other possible causes. That will be a different video. What are the things that we have to rule out? But the 3 criteria are signs of high androgens, irregular cycles, or polycystic ovarian morphology, which can be found either by ultrasound or an elevated AMH on blood work. So let's break those down. So high androgens. The first piece, this can show up as excess hair growth on the face, on kind of going towards the belly button, going lower down the thighs, persistent acne that doesn't let up after your teenage years, or acne that's a bit more treatment resistant and aggressive when you're younger, or female patterned hair loss, which usually looks like the thinning at the crown of your head. So think of the parting line kind of widening. And here's the important part. If those symptoms are clearly present, that alone can count. You don't need blood work to confirm the high androgen status because we can see symptoms of it. But if the symptoms are subtle or unclear, that's when we can check labs. The main ones are total testosterone and free testosterone. And when free testosterone is not available, we can calculate it using the free androgen index. And sometimes we'll look for DHEAS, which comes from the adrenal glands, but also has a very androgenic ability. Here is a major quick pearl. If you're on the combined oral contraceptive pill, it's really hard to reliably measure your androgens. The pill raises sex hormone binding globulin and lowers your androgen availability. So if testing is absolutely necessary, the guidelines recommend coming off the pill for at least 3 months and using another form of contraception during that time and then testing. So if you had androgen in blood work tested while on the birth control pill, you cannot rely on that. So now we're going to go to irregular cycles. This is called oligo or anovulation. And it's not just being off by a couple days. It's defined pretty specifically, cycles that are shorter than 21 days or longer than 35 days or fewer than 8 cycles per year. And if you're more than 1 year past your first period and you've had a single cycle that stretches over 90 days, that also counts as irregular. So now we're getting into ovarian morphology. So this is where there's a lot of myths that come in. 1, everyone needs a pelvic ultrasound. Not true. If you've already met 2 of the 3 criteria, you don't need one. If you've had a pelvic ultrasound under the age of 20, it doesn't count. That's not valid for diagnosis because the ovarian development looks different before 20 and it can be a normal finding. So if you're relying on that for your diagnosis and it was done when you were less than 19, we need to look at it again. And number 3, another big myth is that polycystic ovary morphology means ovarian cysts, and that's not true. What we're actually looking at is the number of follicles. So in plain language, think of it as like how many eggs are running the show, how many eggs are being recruited. that is not the same as having ovarian cysts, which is a totally different thing. And here in the 2023 update, we now have a blood test called AMH. If AMH is elevated, it correlates with a high number of follicles. This is a breakthrough because not everyone has access to a pelvic ultrasound, or some people do not feel comfortable getting an internal pelvic ultrasound. So this opens the door to access. So one last myth is that an irregular period on its own does not equal PCOS. And also high androgen symptoms on its own, or just one pelvic ultrasound on its own. You need 2 out of 3 criteria, not just one, if you are 20 and up. If you are younger, the diagnostic rules shift, and that will be another video. So anyhow, hope this gained clarity. Join the PCOS Shift Society. It's education, it's accountability, it's mindset. So here's the recap. PCOS diagnosis in adults comes down to the 2 out of 3 rule, while also making sure that the exclusion criteria have been met. So what do I mean by that? Kind of like things that look like PCOS are not. I sometimes use the word mimickers. There'll be another video for that. We need high androgens, either symptoms of it, and if that's not clear, then looking for it in blood work. Irregular cycles, well, 2 out of the 3, and or ovarian morphology. Not everyone needs a pelvic ultrasound, and polycystic ovaries are about follicle count and volume, not ovarian cysts. So if you've been unsure about your diagnosis, you're not alone. That's exactly why I created the PCOS Shift Society, a worldwide community where we combine education, accountability, and mindset. It's where you can raise your PCOS IQ and get the support to actually take action. The link is below. I'd love to see you on the inside, or if you're watching this in a different format, it might be in the bio, or if you're on Instagram, just put shift in the comment and we'll send you the invite.